get it right. You know?
What does the metformin do for females and what does it do for males?
So in terms of the female, high insulin creates a problem because it fluctuates your blood sugar. So if we can imagine the normal cell, it's got a cytoplasm, a nucleus, and it's got DNA happening. And if we look at the energy source in it, it's glucose. And you can't do this.
But what does it do to fertility patients, male and female?
So in the female,
Yes.
it's going to actually fluctuate their blood sugar.
Yeah.
And the egg has a problem actually going through its normal growth cycle, its normal energy cycle.
Okay.
So this, if we look at polycystic ovaries, those women, first of all, usually have enormous amounts of eggs, so their AMH levels are very high. In order, what happens in normal ovulation, there's one dominant follicle. It starts to become dominant on about day 6, 7 of the cycle, and it takes all the other ones out. So you start off with 20 eggs, and by ovulation, there's one egg. The ovary needs to look clean, one egg, it releases. When you start to mess up with the sugar, it can't become dominant. It can't get rid of those ones. So you're left with this multicystic picture. And then in some people it becomes polycystic where there's no ovulation. And I'm sure you know that in a woman there's more than one cycle of eggs a month. They can have at least 2, usually 3 or 4 cycles of eggs that are happening. So in a polycystic patient, the dominant egg can't wipe out all of them. And then the next cycle starts. And the next cycle starts. And they're left with this ovary, 100 eggs in each, 100 old eggs in the ovary. So, so that's important. So that in women, it affects ovulation. It also affects the quality of the egg.
Okay.
So as the egg's growing, and as it divides at the end, where it pushes out the one half of its chromosomes, it affects that. So we've had women with recurrent miscarriages, and we've tested them. There's something wrong with the embryo. You put them on glucophage. You make sure the lining's fine. You make sure the physiology's fine. Normal baby. First trimester. Initially, they used to stop metformin with pregnancy, and the miscarriage rate was high. So you've got to keep them on at least for the first trimester. And we keep them on throughout pregnancy because it has a preventative effect on gestational diabetes. Part of the same spectrum, you know. Gestational diabetes is caused by the placenta, but by keeping them on glucophage, that placentation, the formation of the placenta is kept right. And that's in females. In guys, we know that they need fructose to energize the sperm. It wasn't that they weren't getting embryos, but they were getting bad embryos.
Okay.
And we used to blame the females. So we then realized that if you've got poor embryos by day 5 and beautiful embryos on day 3, the male can be, that's actually a male factor sometimes. We started testing them. Thyroid's very important as well in men and women, again, but that's a specific medical problem.
Yes.
Yeah.